What's up everyone and welcome into the video. So today I'm going to be giving an entire breakdown of all the classes that you take as a D1 student at the Boston University Henry M. Goldman School of Dental Medicine. So I'm just going to pull up the website and I'm going to go through all the classes that are listed there, and I'm going to give you some of the details about what the class structure is like and just a general overview of what you can expect as an entering student into Boston University Dental School. During this entire breakdown, I'm going to put a label of the amount of credits that this course requires, as well as the difficulty in comparison to all the other courses that you take as a D1. So pulling up the website, the first class that is listed on the D1 curriculum is SDM GD 510, Comprehensive Preclinical General Dentistry. So this course is started at the very beginning of the year, along with biochemistry. GD1, as we like to call it in its short form, is pretty much your standard introductory class that you have here at BU for your first introduction into general dentistry. So in this course, you're going to be taught all about what teeth are like, and then we're going to go straight into the clinical procedures, starting off with restorative dentistry, also known as operative. So for those of you who don't know, that's mainly a lot about fillings. We go into the history of general dentistry, we go into amalgams, composites, and then towards the later on in the year, that's when we get into fixed restorative dentistry. We also go into removable prosthodontics, as well as endodontics and perio. It incorporates all aspects of general dentistry that you can think about, and that is going to prepare us for the D2 year, in which we get more in depth regarding the different specialties of dentistry. GD1 also incorporates a few other things. This includes the Simulation Learning Center. Every Thursday, we go into the sim lab and practice our skills of general dentistry for the very first time. In GD1, during our first year, it's mainly based around operative dentistry. We just get comfortable using the mannequins, get comfortable using restorative materials, and getting used to all the different types of tools and equipment, and getting us really accustomed to the simulation lab, so that by the time D2 year comes around, we're going to be ready to be in the simulation lab up to 4 times, maybe even 5 times in a week, as well as all the practice that simulation lab entails. In addition to simulation lab, we also have what's called service learning. And during service learning, we go and we prepare a presentation for elementary school kids regarding why their oral health is important at such a young age. So we prepare a presentation with a partner. We do this all throughout the fall semester. We go in, we do rehearsals. We can also be very creative with our ideas regarding this presentation. We run it through our instructors, and then towards the end of the first semester of our D1 year, we give a presentation to elementary school kids about why oral health is important, how to keep their diet really healthy so that their teeth can also stay healthy. Service learning is a very important part of being within the community, and we love that we get to incorporate that aspect within our GD1 course. So for the ranking system, I'm going to give each course of a difficulty level from 0 to 10, with 10 being the hardest. And for GD1, I would put it at about, let's give it a 3. In terms of difficulty level. So the next course is molecular genetics. So molecular genetics you do for a block period during your D1 year. So it's not throughout the entire first semester, rather it's just a few months. And you have one midterm and you have one final exam. And this course honestly is rather difficult. I would give this course about an 8. Molecular genetics, it's given to you at a time where you feel like you want to take a break during the year, but it's just handed to you and you have a few weeks to study for the midterm. And then once that comes around, you're already studying for the final exam. During this class, you have to go over the slides very religiously. You have to study the material over and over again. Repetition is very key for this course. The first exam is essentially about population genetics, whereas the second exam is more linked towards the diseases and genetic disorders related to molecular genetics. Next course is Anatomical Sciences 1, and this is the first semester of anatomy that we take. Anatomical Sciences 1 is a very fun course On a difficulty level, you definitely have to put in a lot of work in memorizing a lot of material. I would give it a 7. Anatomy has a lot of memorization, especially in the beginning. It's a lot of histology. So histology is going to be all about the cell's tissues, a lot about blood and the different organ systems, as well as the cells related to those systems. So during this course, the first 2 exams were more histology based, whereas the last 2 exams were more about development as well as neurology based. So for the histology sections, it's a lot of memorization, a lot of flashcards, whereas for the neurology section, you draw a lot of pathways, and that's the best way to memorize these things, as well as going over a lot of these pathways with your peers and your study groups and just testing each other on the fundamentals of anatomy. Anatomical Sciences 1, I enjoyed that course very much, and the instructors are amazing in that course. Anatomy is definitely one of the courses that you look forward to as an incoming D1 student. So right after that is Anatomical Sciences 2. Anatomical Sciences 1 is strictly for the fall semester, and then Anatomical Sciences 2 is strictly for the spring. So this is your gross anatomy course, in which you're going to learn about a lot of gross anatomy, but mainly from the torso up. So during the first exam of this course, you're going to be learning about the major body systems, and then it's going to work more towards the shoulder and the arm, and then towards the end, you're going to be focused solely on the head and neck anatomy, which is very important for dentistry. And the other thing about Anatomical Sciences 2 is when we get to go into the cadaver lab and we get to study on human donors, and we're very grateful for these donors for letting us learn on them. Anatomical Science 2, it's a continuation of anatomy from the first semester, yet we just go on a more systemic level. In the cadaver lab, we are given summative exams in which we are asked to label and identify structures on the human bodies, as well as on pictures and as well as on the skeleton. We're given a lot of questions regarding those 3 major things in the lab. So I would say Anatomical Sciences 2 is more difficult in that you have a laboratory portion. So you do need to allocate some more time to study for Anatomical Sciences 2, in that you do have 2 exams in a day. You're going to have the lab exam followed by the written exam. So those do take a little bit more effort. For Anatomical Sciences 2, I would give it also a score of 8 in terms of difficulty. Next up on the list is biochemistry. So biochemistry is going to be the first course that you ever take as a D1 student here at BU Dental. For biochemistry in dental school, you're going to go over the history of biochemistry, you're going to go over amino acids, you're going to go over enzymes, DNA, proteins, followed by the section on metabolism. So oxidative metabolism, you're going to go over Krebs cycle, and then towards the end of biochemistry, you're going to go over connective tissue, as well as some forensic biochemistry. They do incorporate dentistry really well in this course. And so biochemistry, it's a lot of memorization, and so for those of you who really like doing flashcards and drawing things out, this is the course that you're going to enjoy very much because it's taught by some amazing professors. So for biochemistry, I would give it a difficulty score of about 6. Next up on the list is physiology. And physiology is the hardest course you're going to take in your D1 year here at BU Dental. Physiology course is very concept based. If you're one of those students who learn well best by memorizing, that is not going to be the greatest strategy when approaching physiology. The best way to prepare for physiology is going over the material many times, followed by running it through your classmates to making sure you understand the concepts, followed by doing a lot of practice questions. First, I'll give you a breakdown of what physiology is about. So you're going to go into how the body works. So it's going to be supplemental to the anatomy course, except for this time you're going to go into how each of the structure works, and it's going to be divided into systems. So you're first going to have neuro, followed by cardiology. After that is respiratory physiology. After that, it's going to be your GI and renal systems, and then you're going to have endocrine physiology. So physiology is going to be the course that's going to take up the most amount of time of you preparing for, and it's going to delve deep within these topics and making sure you understand the concepts of how the body works. Just given the breadth of knowledge that you need to obtain to do well in physiology, I'm going to give physiology a difficulty rating of 10. It's going to probably give you the most stress of all these other courses, but when you finally finish physiology, you are going to feel so rewarded about how much you have learned, and you're going to feel like that you truly earned your spot here as a dental student if you've done well in this course. So our next course that we come across is microbiology and immunology. This course is a lot about memorization as well, so I'm going to give it the same score as biochemistry. I'm going to give it a 6, and this is going to delve deep into medical microbiology. You're going to talk about bacteria, viruses, DNA, fungi, and a lot of different parasites. Next course is general pathology, and it's going to cover the fundamental concepts of pathology as well as their differential diagnoses. And pathology was a great course. It's one of those shorter courses as well. If you just memorize the material really well and bounce it off of your other classmates, you're going to do well in this course. For general pathology, I would give the difficulty rating of about a 3. Next course is oral biology. So oral biology, it goes into the embryology and the microscopic and macroscopic structures related to the oral cavity. Oral biology is a really interesting course strictly because it's information you're going to use for your entire career. As future dentists, we find this material in this course very interesting. You get to learn about the biology of the oral cavity, you get to learn about the gingiva, you get to learn about the structures of the teeth, and you also get to learn about karyology and bone structure, all of which are very important in your future careers as dentists. Oral biology, it's a great course. I would give it a difficulty rating of about 5. Next course is oral diagnosis and radiology 1, and you're going to learn all about how to read radiographs, the technology and instrumentation related to radiography. It's going to be very relevant to your future careers. So I'd give the difficulty rating of this course a 4. So for professional ethics development, this is a Friday course. It's given at the very end of the week, and lecture is mandatory. So in the fall semester, you have to buckle down and make sure you come to class because attendance is taken. This class is arguably one of the most important in that professional ethics is brought up a lot on your board exams. It's going to be very important that you know the material taught in this course, especially as you get promoted to higher levels of your dental school career. So I'd give the difficulty level of this course about a 2. The next course is evidence-based dentistry. I will also give this course a difficulty of 2. You do have to go to some seminars and that you participate in group discussions. You also do have to submit some journal entries. Overall, you talk a lot about what evidence-based dentistry entails. You learn about how to interpret research and how to relay that information to your future patients. So the next course that we have is Applied Professional Experience. This is going to be our APEX, also called Applied Externship. So this is given during the summer after our didactic D1 year. And during APEX, you have the option of getting accepted to participate in research projects. You can also complete APEX by doing extended clinical rotation. This is just when you get to get accustomed to a dental office. You get to learn from practicing dentists who are out in the field. You get to get mentored by them, and you get to learn about all these different procedures before eventually going into your D2 year, in which you're going to be performing and practicing these procedures in the SLC. APEX is a great experience. You can also do your externship close to home. And the final course on the website is dental anatomy. So this course, you get to learn strictly all about teeth. You get to learn about the different characteristics of every single tooth. And this is also where you get to go into the SLC to practice waxing up teeth. And you get to learn about all the different aspects so that when you start restoring teeth, to properly restore a tooth, as well as how to recreate that anatomy when you're doing fillings, doing crowns. This is a very detail-oriented course, and you need to apply those details into clinical scenarios to prepare you for the exam. I would give it about an 8 in terms of difficulty, as this is going to be very important for your clinical knowledge in the future. So that's pretty much a breakdown of all the courses that you take as a D1. So this is the amount of credits that you take for the entire D1 year. The biggest piece of advice for those who are coming into BU GSDM is that be very excited, yet also be prepared to work very hard It's going to be a very strenuous and challenging year, but it's going to be very rewarding. So that is the entire breakdown of the curriculum of the D1 year here at Boston University Henry M. Goldman School of Dental Medicine. If you like this type of content, please don't forget to like, comment, and subscribe. And I can't wait to connect with even more of you in the upcoming future. Once again, thank you all so much again for watching. Get excited for more content, and I will see all of you again in the next one. Bye, everyone.